My name is Dr. Farman Ali and I am a GP family physician. Today we will be talking about headaches. It is one of the most common presentations to general practice. There are many different types of headaches, but they are broadly classified into primary headaches, which include tension type headaches, migraines, cluster headaches, and medication overuse headaches. There are some other less common type of headaches, which includes exertional headaches, sexual headaches, primary stabbing headaches, hemicrania, and trigeminal neuralgia. So, one of the most common questions is my headache serious? Now, serious headaches include subarachnoid headache. This is caused by bleeding in the brain. The headache starts extremely suddenly and it is also referred to as a thunderclap headache. Patients develop a severe headache within a few seconds. They may have associated neck stiffness or become unconscious. Another type of serious headaches is caused by meningitis, which is an infection of the covering of the brain. This is usually associated with a rash, feeling sick, high temperature, and patients will not be able to bear strong light, also known as photophobia. Patients will have a stiff neck and would be unable to bend the head so that the chin touches the chest, even if you try to relax. Patients are usually very unwell, hot, sweaty, and very ill. Another type of serious headaches is giant cell arteritis or temporal arteritis. This happens in patients over the age of 50, and this is caused by inflammation of the blood vessels in the temples and around the eye. There is associated scalp tenderness in these patients, and patients will notice that when they are combing their hair, and made worse when they are chewing. Temporal arteritis is serious because if it is not treated, it can cause sudden loss of eyesight. The treatment is urgent blood tests, a biopsy, and a course of steroids is started. Brain tumor can cause headaches. Usually the headache of the brain tumor is present on waking in the morning. It is worse on sitting up and gets steadily worse from day to day. It's a never easing headache and does not disappear. It can sometimes be made worse by coughing or sneezing. So, what are the red flag signs in patients who require further investigations? The kind of symptoms that make a doctor wish to do further tests are the red flag signs, and I will go through them one by one. If a patient had a serious, significant head injury in the previous 3 months, if the headaches are worsening and accompanied by high temperature, if the headache develops and there is associated speech and balance problems with it, if you have developed memory issues and changes in behavior as well as headache, this requires further investigations. Some other red flag signs are if a patient is confused or muddled with the headache, if the headache started when you coughed or sneezed or strained, if the headache is worse when you sit or stand, if the headache is associated with red and painful eyes, if the headache are not like anything that you have experienced before. Unexplained sickness with headache also needs investigation. Patients with low immunity, such as those with HIV or those who are on steroid medication, which suppresses their immune system, they need further investigation. There are certain types of cancers that can spread to the brain, and those patients require further investigations. So let's discuss the headaches. The first type of headache that I want to discuss is tension type headache. Tension type headaches are usually felt as like a band across the forehead. It is felt on both sides of the head. Most often it is on the front. They can last for anything from few hours to several days, although a few hours is most common. Tension headaches tend to come on during the day and worsen as the day passes. The pain is usually moderate or mild, but sometimes it can be severe. Tension headaches can interrupt concentration. Tiredness, anxiety, and hunger can also make these headaches worse. Too much caffeine or alcohol, if they don't drink enough water, can also make tension type headaches worse. So what are the causes of tension type headache? The exact cause of tension type headache is unclear. Some may be due to the muscular tension. However, many tension type headaches develop for no apparent reason. Some of the triggers include emotional tension, anxiety, tiredness, or stress. Physical tension in the muscles of the scalp and neck, eye strain, hunger, physical factors such as bright sunlight, cold, heat, or noise. Your genetic makeup may also be a factor. So how do we treat tension type headaches? First, we talk about the general measures that you can take. A walk, some exercise, or simply taking a break from normal routine may help. A neck and shoulder massage also helps. Drinking less caffeine and more water is certainly helpful. Try to have a sensible diet. Eat regular. Do not have foods with lots of sugars in it. Rather, rely on slow releasing energy foods. Reducing the number of pillows can sometimes help, particularly if you sleep on more than 2 pillows. Sleeping on one side with high pillows means that your neck is bent, which can cause tension and then subsequently lead to headaches. Other ways to avoid tension type headaches is by having plenty of sleep and avoiding excessive noise. So we come to the medication which are used for treating tension type headaches. Paracetamol often works quite well. It is best to take a full dose as soon as the headache starts. This may ward off the headache better than treating it after it has fully developed. Anti-inflammatories. These include your ibuprofen, which you can buy over the counter, and some other medications such as diclofenac or naproxen, which require a prescription from your doctor. Remember, people with asthma, cardiac problems, or those with stomach or kidney problems should not take anti-inflammatories. They're also contraindicated in patients who are pregnant and breastfeeding. Opioids, which include the codeine as well as the combination drugs cocodamol, are not normally recommended for tension type headaches. So how can we prevent tension type headaches from coming in the first place? The general measures that you can do is, number 1, to keep a diary. When, where, and how bad each headache was, and how long did it last for. If you do that, soon a pattern will emerge, and you may find the triggers that you can avoid. For example, hunger, eye strain, bad posture, or stress. Avoiding stress. A stressful job or situation that cannot be avoided, you may learn how to cope with it or to relax in between. Breathing and relaxation exercising can also help. Regular exercise Some people with a frequent headache say that they have fewer headaches if they exercise regularly. If you do not do much exercise, it may be worth trying regular activities such as brisk walking, jogging, cycling or swimming. Medications that are used for prevention of tension type headaches include amitriptyline, which is given as a 10 or 20 milligram once at night dose. Now this is basically an antidepressant medication, but here it is not used to treat depression. It is given at a low dose and increased over time. Once the headaches have been reduced for 4 to 6 months, the amitriptyline can be stopped. Treatment can be resumed if the headaches recur. Other medicines are sometimes tried if amitriptyline is not suitable or does not help. The question is when to start preventative treatment for tension type headaches. If you are having tension headaches for more than 4 times a month, then preventative treatment is considered before the headaches become more frequent. As I mentioned earlier, it is best to keep a headache diary for a couple of weeks or so before starting these preventative medication. This will not only help you identify the triggers, but also let you know how severe your headaches were and how well your treatment has worked. One of the most common type of headaches is migraine. Now, remember, migraine is a condition that causes attacks or episodes of headaches. There are associated symptoms with it, such as feeling sick or being sick. You may get a warning phase, which is also known as the premonitory phase, in which the patient is irritable, depressed or tired. They may have food cravings and they just know that the migraine is going to occur. This is followed by the aura phase, if it happens in certain patients. This is followed by the headache phase and eventually the resolution phase, when the headache gradually fades away. Typically, the headache of a migraine without aura can last between 4 and 72 hours. A distinguishing feature is that between migraines, the symptoms will completely go away. So what causes migraine? There are many theories that have been proposed. One of the most common one is that the blood vessels in parts of the brain become narrower or go into spasms, which accounts for the aura part of the headache. The blood vessels then are thought to open up or dilate, and this accounts for the headache phase. Another theory is that some chemicals in the brain increase in activity, and parts of the brain may then send out confusing signals, which causes the symptoms. Menstrual migraine is thought to be due to the fall of estrogen that occurs at this time in the cycle. Estrogen is one of the chemicals or the hormones that controls the menstrual cycle. So we come to the symptoms of migraine. Typically, migraine is at the front or the side of the head. Sometimes it is on both sides of the head. The pain is described as moderate to severe and is often described by the patient as a throbbing or pulsating pain. Typically, it gradually becomes worse and peaks somewhere around 2 to 12 hours and then gradually eases off. The duration of the migraine can last between 4 and 72 hours. As mentioned earlier, feeling sick or being sick is also an associated sign of migraine. Patients do not like bright lights or loud noises, so they might like to lie down in a dark room or try to sleep it off. There are two types of migraine: migraine with aura or without aura. Visual aura is the most common type of migraine aura. It usually affects just one side of your vision and gradually gets bigger over the next 5 to 20 minutes. Examples include a temporary loss of vision or part of the vision, a bright shimmering light, often in a C-shaped pattern, a bit like looking through an old-fashioned kaleidoscope, or some patients may describe it as zigzag lines. Objects or letters on the page may seem to rotate, shake, or boil. Other types of aura include numbness or pins and needles. This is the second most common type of aura. Numbness usually starts in the hand and travels up the arm, involves the face, lips, and tongue. Occasionally, the leg may be involved. Problems with speech are the third most common type of migraine aura. Other types of migraine aura include odd smells, food cravings, a feeling of well-being, and other odd sensations. One of the migraine auras may develop, or several of these may occur at the same time. Each aura usually lasts just a few minutes before going, but can last up to 60 minutes. Remember, with all these type of auras, do not forget the signs of stroke. So what are the triggers of migraine? Different patients have different triggers. Diet is one of the common triggers. Dieting too fast, irregular meals, cheese, chocolates, red wines, citrus fruits, foods containing a substance called tyramine is also known to cause migraines, and not drinking enough water, dehydration. Environmental factors such as smoking or living with a smoker in smoky rooms, glaring lights, screens, or flickering TV sets, loud noises, and strong smells in the surroundings. Psychological: depression, anxiety, anger, tiredness, or stress. Many people with migraine cope well with the stress, but have attacks when they try to relax. Hence, we call it the weekend migraines. Some of the medicines, for example, the HRT, sleeping pills, and certain contraceptive pills. Periods or menopause can also have effect on migraines. Shift work and a changing sleeping pattern is also known as the trigger of migraine. Does migraine occur in children? Yes, it does. Migraines is common in children. It can affect 1 in 10 children of school age. The symptoms can be similar to those experienced by adults, but attacks are often shorter, and pain may be in both sides of the head. Also, associated symptoms in children include nausea or vomiting. You may have heard the term abdominal migraine. This mainly occurs in children. Instead of headaches, the child will be complaining of tummy pains, which lasts several hours. There may be associated sickness or just the feeling of sickness. Commonly, children who have abdominal migraines, they tend to have common migraine in their teenage years. The triggers in children include missing meals, lack of fluids, dehydration, or irregular routines. Many of the medicines that are used by adults are not licensed for children, so general measures are the best way to start. Migraine when pregnant or breastfeeding. The good news is that about 2 in 3 women with migraine have an improvement whilst being pregnant or breastfeeding. However, 1 in 20 women with migraine find their migraines get worse while pregnant. Bad news is that many of the medicines that are used to treat migraine should not be taken while being pregnant or breastfeeding. Other types of migraine which are less common, they include the menstrual migraine, as I mentioned at the beginning of the presentation. Menstrual migraines are migraines with or without aura, and it is at the timing of the migraine that makes it menstrual migraine. Ocular migraine, sometimes also known as retinal migraines, ophthalmic migraines, or eye migraines, cause a temporary loss of all or part of the vision in one eye. Hemiplegic migraines, this is rare. In addition to a severe headache, symptoms include weakness, like temporary paralysis of one side of the body. Remember, if any such red flag signs occur, you should refer the patient for assessment so that stroke can be ruled out. Vestibular migraine. It may affect up to 1 in 100 people. It causes episodes of severe dizziness alongside typical migraine symptoms and lasts between 5 and 72 hours. Another type of migraine, basilar type migraine. This is thought to be migraine originated due to problems in the basilar artery in the brain. So what is the treatment for migraine? Paracetamol and aspirin both work quite well for migraine attacks. Take a dose as early as possible. If you take painkillers early enough, they often reduce the severity of the headaches or stop it completely. Some people do not take painkillers until the headache fully develops. This is often too late, and the painkillers do not work as well. Aspirin, as I mentioned, it's basically an anti-inflammatory. Recently, we are not using aspirin as often, or it's not one of the favorite treatments for other conditions. However, it is still very useful for migraine. It is best not to use codeine and medication containing codeine such as cocodamol to treat migraine. This is because codeine can cause sickness and vomiting, and with migraine you already have nausea and sickness, which can make matters worse. Non-steroidal anti-inflammatory drugs, or simply known as NSAIDs. These anti-inflammatory drugs, they include the ibuprofen, which you can buy over the counter from any pharmacy. However, for other types such as diclofenac and naproxen, you need a prescription from your doctor. Remember, patients with asthma, heart problems, stomach and kidney problems, or if the patient is pregnant or breastfeeding, should not use anti-inflammatories. Ideally, an anti-inflammatory medicine is taken with some food or milk, and that reduces its impact on the stomach lining. Sometimes your GP may prescribe a stomach protection tablet such as omeprazole or lansoprazole. One brand of ibuprofen dissolves in the mouth and may be swallowed with the saliva. This makes it easier to take that tablet if you're feeling sick. Nausea and vomiting is common in migraine. So, what should we do? You can use soluble, dissolvable painkillers. They are absorbed more quickly as compared to the ones from your stomach and are likely to work better. One brand of diclofenac comes as a suppository. This may be useful if the vomiting is very bad. You can take anti-sickness medication in addition to the painkillers, for example, domperidone, prochlorperazine, or metoclopramide. Some brands of migraine tablets contain both a painkiller and anti-sickness combined together. Tryptons. Tryptons are not painkillers, but tryptons work by imitating the action of a chemical called 5-HT, also known as serotonin, in the brain. And many different types of triptans available. Sumatriptan, this is also available as an injection. Rizatriptan and Zolmitriptan, which are available as a wafer or a tablet, and they disperse in the mouth, and then it can be swallowed with saliva. Zolmitriptan and Sumatriptan are also available as nasal sprays. You should take the first dose of your triptan when the headache is just beginning to develop, but not before that. If the triptan worked to relieve the headache, but then the headache returned later, you can repeat the dose after 2 to 4 hours. Triptans are contraindicated and should not be taken by patients with high blood pressure, risk of angina or heart attack, those with a history of stroke or mini stroke, those patients who are pregnant or breastfeeding. How can we prevent the migraines from coming in the first place? Keep a headache diary. The benefit is twofold. First, it gives you the triggers that you can identify and try to avoid. Secondly, it also assesses the efficacy of your preventative treatment. So when can you start prevention medication? If you are getting 2 attacks per month that cause significant disruption to your life, you can consider preventative medication. If you have less frequent attacks but they are very severe, you can consider preventative medication. If there is a need of a lot of painkillers or triptan medicines to treat your migraine attacks, your doctor may consider prevention. If the painkillers or triptan medications are not working very well, or you're unable to take them because of the side effects, you may consider preventative medication to stop the headaches from coming in the first place. Remember, there is always a risk of medication overuse headaches, and your GP may consider giving you preventative medication. Menstrual migraine, which cannot be avoided, sometimes requires preventative medication. So what medicines are used to prevent migraine from coming in the first place? Beta blockers is the most commonly used, and these include the propranolol, atenolol, metoprolol, timolol, and nadolol. They are used primarily for treating heart conditions and high blood pressure. However, most commonly propranolol is used to prevent the headache from coming in the first place. They should not be used by patients who have asthma or peripheral vascular disease. Anticonvulsants. These are medications such as sodium valproate and topiramate. They are used for prevention of seizures of epilepsy. However, we found that they were very useful in preventing migraine attacks. Amitriptyline is also used. This is primarily an antidepressant, but in this instance it is used at a low dose of 10 to 20 milligrams at night to prevent migraines. Other medications have been tried, and they include Prizotafin, gabapentin, some blood pressure medications, and occasionally some antidepressants. Botulinum toxin or Botox injections to prevent migraine. Now, this is given as a treatment of 5 courses of treatment of Botox injections every 12 weeks. These injections are given into the muscles of the head and neck. NICE recommends Botox can be used as a possible treatment for preventing migraine in some adults with persistent chronic migraines. The criteria set down by National Institute of Clinical Excellence includes if you have chronic migraine, if you have already tried at least 3 different types of preventative treatments and they have not worked, and you are not taking too many painkillers or using them too often. The third most common type of headaches is called cluster headaches. Remember the word cluster. These are attacks of severe one-sided headaches. They usually come in bout or clusters and can last for weeks, months, or years until the next cluster develops. Typical case is a cluster lasting between 6 and 12 weeks. They are 4 times more commonly in men than in women. The first bout or the cluster develops typically between the ages of 20 and 40 years. Other signs include it is a one-sided headache, often around the eye. They usually begin quickly and without any warning. The attacks can last between 15 minutes and 3 hours, and the pain during an attack is usually described as severe. They usually occur every day, often up to 8 times a day. Attacks often occur at night time, a couple of hours after you have gone to sleep, and it may wake you up. Redness and watering of the eye, swelling or drooping of the eyelid is common, and the constriction of the pupil in the eye. A runny or bunged up nose and sweating of the face is also common. So what causes cluster headaches? It is thought that during the attack, a part of the brain called hypothalamus releases chemicals which are called neurotransmitters, and they may stimulate the nerves in the brains to cause pain and other symptoms. Alcohol. Some people find that the headache often occurs within an hour or so of having an alcoholic drink. It is usually advised to stop alcohol completely for the duration of a cluster period. Being hot may trigger, such as exercising in a hot room or having a hot bath. Strong smelling substances such as solvents, perfumes, or petrol. Almost all people with cluster headaches do not have any abnormality of their brain. However, 1 in 20 people, there is a family member who also suffers from cluster headaches. So what is the treatment for cluster headache? Sumatriptan injection given under the skin, also known as subcutaneous injection, is commonly used treatment for headache. It works within 5 to 15 minutes to ease the headache. The adult dose of this would be 6 milligrams of injection for each headache, and the maximum in 24 hours is 2 injections totaling to 12 milligrams, with a minimum gap of at least 1 hour between the 2 doses. Some people should not take sumatriptan. For example, those who are with heart problems, previous stroke, or peripheral artery disease. Zolmitriptan, which comes as a nasal spray, is an alternative to sumatriptan injection for treatment of cluster headaches. 100% oxygen is given as a treatment for cluster headaches. This is an alternative that may be advised, especially if sumatriptan injections or zolmitriptan nasal spray cannot be used because of their side effects or contraindications. It often works quite well, relieves the pain within 15 minutes, but it does not work in everyone. The advantage is, when it works, that it can be used as often as necessary. The oxygen is 100%. Remember, the air that we breathe is 21% oxygen. So this is delivered through a special mask from an oxygen cylinder. Some people with cluster headaches have an oxygen cylinder and a mask kept at home. Can we prevent cluster headaches from coming in the first place? Medication called verapamil is commonly used as treatment. This medication is usually used to treat heart problems, and therefore you will require an ECG or electrocardiogram before increasing to high doses. Another type of medication called lithium. This medication is more commonly used to treat bipolar disorders, and people who are on lithium requires regular blood test to measure the dose in their blood. This can be used as an effective treatment to prevent cluster headaches. Steroids, corticosteroids, they are used in short bursts of 2 to 3 weeks in decreasing amounts. Ergotamine and topiramate are also used to prevent cluster headaches. Another type of headache is medication overuse headache. Medication overuse headache is caused by taking too many painkiller medications, and usually they are started for headaches themselves. Unfortunately, when you are taking too many painkillers regularly for headaches, the body responds by making more pain sensors in your head. Eventually, the pain sensors are so many that the head is super sensitive and the headaches would not go away. Most common medications that are known to have caused medication overuse headaches include opiate such as codeine, cocodamol. Tryptons used for migraine attacks are also known to have caused medication overuse. Ergotamine, which was previously used but now it is rarely used. Other types of headaches that I want to discuss briefly include exertional or sexual headaches, are headaches associated with physical activity. They can become severe very quickly after a strenuous activity such as running, coughing, having sex, and straining with bowel movements. Primary stabbing type headaches. These are short stabbing headaches which are very sudden and very severe. They usually last between 5 and 30 seconds. They can occur during the day or night. They feel like a sharp object like an ice pick being stuck into your head. Remember, they last very short period of time. Hemicranial Continuum is a primary chronic daily headache. It typically causes a continuous but fluctuating pain on one side of the head and sometimes is confused with cluster headaches. Trigeminal Neuralgia. This is caused by facial pain. The pain consists of extremely short bursts of electric shock type pains in the face or around the eyes, nose, scalp and forehead. It is usually one-sided and is most common in people above the age of 50. It can be triggered by a light touch or light breeze to the face. Remember, the patients will say it is like an electric shock. Referred headaches. They are caused by pain in some other part of the head such as your tooth or ear, pain in the jaw joint or sometimes pain in the neck. Another most common cause of referred headache is sinusitis, which is the most common cause of it. The headache of the sinusitis is often felt at the front of the head and also in the face or teeth. Often the face feels tender to touch, particularly just below the eyes. Glaucoma. The pressure inside the eyes goes up suddenly and this can cause very severe headache behind the eye. So, we talked a lot about headaches. In short, most headaches, while they are unpleasant, are harmless and respond to simple measures. Migraine, tension type headaches and medication overuse headaches are very common. Headaches are very rarely a sign of a serious or sinister underlying condition, and most headaches go away by themselves. Thank you very much.